I felt pretty good during this encounter. Walking in, seeing that it was going to be a gen med case. We haven't had a ton of gen med cases, and I haven't experienced a lot of them through practice so far, so I always enjoy having them with the SPs because it's an exposure for me to have. I thought it went pretty well. For me, when I got in there and started talking to her, things I immediately did was I went ahead and took vitals and then rechecked them about 5 minutes later, see if anything had changed, and started diving into the history, seeing if anyone else around her had been showing any of the same symptoms, seeing if, family, roommates, any of them, and also talking to her, what have you been eating lately, trying to see if there's any diet issue causing the stomach pains that she was having. And then when she was asking me questions, I was pretty responsive and able to answer what she was asking. When she had asked about mono and my thoughts on it, I gave her immediately what I was thinking. Since there was no enlarged spleen, she wasn't really fatigued, she was just having stomach issues. I told her, and since no one else around her had been showing signs and symptoms of the same issue lately, I told her I'm not worried about mono, but it's something just to always be a little concerned about. What didn't go well is I think I just didn't dive far enough into that history with the patient. I did palpations, I did my vitals. I didn't do any lung or heart auscultations, which I should have done. I didn't do any lung percussions, which I also should have done. But overall, I think it went pretty well. For this impacting patient care in the future, I treat this just like I treat most gen med cases. Just the thing I need to start moving past is immediately being like, hey, well, why don't you go over to the student health center and let them look at you. Being a little more confident in my diagnosis instead of just using that as a safety valve when I'm kind of on the borderline on if it could be something a little more serious or something that's not anything to worry about at all. Just kind of starting to make that distinction between the two.